I don't know that I'll be able to have a chat with her face to face, but I'll take it. Okay. The work that we've done with this outpatient department has turned it from a small sort of provincial outpatient department into something that is state of the art and a lot more modern. The first thing patients see when they walk in are 3 touchscreen kiosks so they can self-check-in. There are call screens in separate wait areas so that the doctors don't have to walk very far and call out patients' names. Some of the projects that we've done are trying to improve discharges from the hospitals. We pioneered this system called Countdown to Discharge, which basically was mapping out the current discharge process. We had a large workshop. We had 30 people in a room for about 4 hours with post-its all over the place, trying to map a process that doesn't exist. So that was a really frustrating experience because we realized somebody said, it's a miracle we get patients out at all because it's very, very complex. If you think of ED or a hospital like a hotel, you have to check out by a certain time to allow patients to check in. And we know the presentation patterns in ED sort of follow a very predictable pattern, so we need to get discharges quite early in the day for there to be good flow. So what we did was we got all these people together, learned what we were trying to improve, and we basically came up with a set of business rules. So all patients who've been in the hospital for more than 24 hours must have an expected date of discharge. We must know where they're going within at least 48 hours, so it makes a difference if they're going home or if they're going to subacute, and a number of things that most people would agree are kind of common sense things that we should do. In the wards that we've trialled this new system, we were able to increase the proportion of pre-10 a.m. discharges from about 7% of our patients to over 30% of our patients. So that's a big jump, and it was certainly unprecedented for Peninsula Health. I think there's this big movement now towards value-based healthcare and really looking at what are we paying for? What are the outcomes that we're getting? Are we getting outcomes that are meaningful to patients? Or are we just doing healthcare for the sake of providing services? When I was 25, I gave myself these really naive goals. I said I have a 10-year plan and a 20-year plan. My 10-year plan was to be a CEO of a hospital, and my 20-year plan was to be CEO of my hospital, sort of designed from scratch the way I sort of have it in my head, how things should be so that they're as efficient as possible. A little bit behind schedule with my 10-year plan, but I think the MBA has certainly helped nudge me along, and we'll see how we go for the 20-year plan.